I start my presentation, I'm gonna tell you guys that I have a simple game for you guys after my presentation. So I have here three $10 Starbucks gift cards. So we're gonna play a game after my presentation.
So listen up.
So my presentation is about preparing and staining blood smear. So can you imagine, guys, in just a tiny drop of blood, it tells us the patient's health condition. So today I'll be discussing the correct procedures for preparing and staining a high quality blood smear to create a thin, even layer of blood on a slide that can be viewed under microscope to examine the size, shape, and number of individual cells. So the purpose of my presentation is to explain the correct procedures for preparing and staining a high-quality blood smear. The blood smear as a vital diagnostic tool for hematologic disorders such as anemia, leukemia, and parasitic infections. It allows for the microscopic evaluation of blood cells, which is vital for diagnosing and monitoring a wide range of conditions. So its aim are assess blood cell morphology like size, shape of red blood cells, white blood cells, and platelets. It detects parasites and microorganisms like parasites and bacteria, monitor treatment effectiveness, diagnose bone marrow disorders, and screen for blood clotting disorders. So how to prepare the blood smear? The goal for preparation of blood smear is to create a thin, uniform layer of blood cells that can be viewed under the microscope to assess their morphology, count, and distribution. So for step 1, a small drop of blood, like around 2 to 3 millimeter diameter, placed near one end of the slide. The drop should be small enough to spread evenly but not too thin to dry out. And then step 2, using a second spreader slide held at a 30 to 45 degree angle. Pull the spreader slide back into the drop of blood until the blood spreads across the entire width of the spreader slide. The right angle will have a smooth spread and ideal thickness. So the next step would be the smear should cover 3/4 of the slide, ending with a feathered edge. A smooth, rapid, and even push motion to create a thin film, that would be the best zone for microscopic examination. So lastly, allow to air dry the slide. Let the smear dry completely before staining to avoid artifacts and to prevent distortion or loss of cells. So characteristics of a high quality smear should have a proper length about 2/3 of the slide. It should have well-defined feathered edge. The smear should transition smoothly from thicker area for cell counting to a thinner area for differential analysis. And there should be no irregularities, holes, or streaks. So the common causes of poor blood smear, drop blood size, jerky motion, speed, and an incorrect angle. So for the drop size, an incorrect drop size can lead to a smear that is too thick or thin. And then for the jerky motion, it can cause uneven thickness. For the speed, the faster creates a longer thin smear, and for the slower, creates a shorter, thicker one. For the incorrect angle, it can affect the smear quality. The steeper angle, smear will be thicker. The lower angle, the smear will be thinner. So before staining, ensure the slide is completely air dried before staining. So the purpose of staining is to allow for the identification and differentiation of blood cells, platelets, and any potential parasites under microscope by coloring their structures. If you can still remember what we did during class, we did the staining there. It's just the same like this. So the first step, dip the slide into the methanol base for the solution 1 for 1 second, repeating it for 5 times. And then the next one, into AUCIN stain 5 times, 1 second each dip. For the solution, the next solution, dip the slide into blue basophilic stain 5 times and 1 second each dip. Rinse the slide with distilled water or buffer solution. Gently shake off excess water and stand the slide upright to air dry completely. So for the preserving and staining the smear, we need to ensure that this staining is clear and distinct. Poor staining can be caused by issues with the stain, its concentration, and the rinsing process. Poor quality slide should be discarded and remade, as a reliable interpretation cannot be made from a poor slide. So for my last slide, the storing blood smear. Store slides in a way that prevents damage from moisture or dust and insects. Avoid cold storage, as freezing can cause cell rupture. Store slides flat in container to prevent them from sticking together or getting damaged. Label the slides with patient's name and date. So in conclusion, the quality of the slide directly impacts the accuracy of the diagnosis, making the technical proficiency essential in the laboratory setting.
So, is your video the one you sent me?
This one, Mom.
Oh, will it open? Is it up? Remember the name of it? Yeah, good.
Today I'm going to show you the basic process of making a blood film in the laboratory. I've got my EDTA tube here, 2 wooden applicator sticks, a spreader, and a blood slide. So I'm going to start by making the blood nice and homogeneous by inversion, about 5 times, not too fast, you want to make blood any bubbles. Open the tube, you insert your applicator sticks. You want to give it a nice mix to check for any clots. Pull the sticks out. There's no clots, they will stick to the sticks. You get a nice drop of blood on the slide. Not too big, about that size. Grab your spreader. Hit the slide in front of the drop and pull it back to the drop. It'll spread across the spreader, and then a nice fluid motion forward until you hit the edge of the slide, and then you've got a nice smear. It's got a feathered edge, ends about halfway up the side of the slide, and that's how you make a blood film. So the next stage is to stain your smear. So after you let it dry by air drying it or in front of a fan, but nothing with heat like a hairdryer. I'll show you the dip quick method of staining. So I've got my fixative, my quick dip 1 and quick dip 2, and then some rinsing water. So the first step is 10 dips in the fixative. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Drain off the excess. 10 dips in dip 1, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Drain off the excess. And then 10 dips in dip 2. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then rinse off in water. And there you have your stained slide. Just let it dry and it's ready for reading.
This mine's got if you make your blood smear too thick on your slide? What do you think could happen?
You won't be able to read the cell morphology clearly because the smear is too thick.
Good job. You do that either? Is that what? You wanna stand in front so you can see him? You're good right there? Okay.
Okay, yes. Mary?
See if she's right. What? Wow.
Zane.
What?
Lymphocyte.